Hi, my name is Amanda Owen, and for my etiology project, I chose the West Nile virus. The reason that I chose the West Nile virus is because whenever I was in school, one of my best friends actually ended up catching West Nile virus. So I wanted to do a little bit more research about it and present it to you guys. Just a little small history, a few bullet points on the West Nile virus. It was first found in northern Uganda in 1937. There have been multiple outbreaks since the discovery of this virus. The West Nile virus was first found in the United States in 1999, actually in New York State. But the largest outbreak was in the United States was in 2002. So West Nile virus is, I believe that I'm saying this right, is a genus falcivirus. And it is a single-stranded RNA virus. On the right-hand side of the screen, you can actually see what West Nile virus looks like. So the transmission of West Nile virus actually came from birds, and mosquitoes would bite the birds, and then the mosquitoes would then be a carrier for the West Nile virus. And then the mosquito, of course, would bite us humans and pass on the West Nile virus to us. So there are actually three different tiers, is the best way I know to describe it, for the symptoms of West Nile virus. 8 out of 10 people actually show no side effects at all. 1 out of every 5 people will have a febrile illness, and then 1 out of every 150 have serious West Nile virus. And we'll go into all three of those in detail. So whenever you have the febrile illness, you tend to have headaches, body aches, fatigue, joint pain, vomiting, diarrhea, and some people will even get a rash. Most of the people who get this type of West Nile virus, the febrile illness, actually recover completely. But the fatigue and weakness can stick around for a few weeks or even a few months. Now, whenever people get the severe or the serious West Nile virus, that is whenever it starts attacking the central nervous system. This is where people really start to have issues. And again, 1 out of every 150 people who contract West Nile virus will go into this category. These side effects are much more intense and very life-threatening. A lot of these people, the West Nile virus will lead to encephalitis, which is inflammation of the brain itself, or meningitis, which is inflammation of the membranes around the brain and the spinal cord. So for these patients, their symptoms are actually a high fever, headache, stiff neck, altered level of consciousness. So they may be disoriented or just kind of not really there. Maybe a lights on, nobody's home type situation. They can have coma, they can go into a coma. They may even have convulsions or seizures. Um, they'll have muscle weakness, numbness, paralysis, and visual disturbances, blurry vision, um, things of that nature. So while the severe illness can happen to people of any age, people who are over the age of 60 are actually at a much greater risk of developing this serious form of West Nile virus. Um, Also, people who have certain underlying conditions are at an increased risk, such as cancer, diabetes, hypertension, kidney disease, and organ transplant patients. So to recover from this serious form of West Nile virus, it may take several weeks or months. However, some of the effects to the central nervous system might actually be permanent. So whenever we go into the treatment for West Nile virus, the milder form, which, the febrile, the febrile illness, over-the-counter medications generally take care of this. So it's rest, fluids, ibuprofen, Tylenol, whatever you take for over-the-counter pain relievers. That is what your doctor would tell you to do. However, whenever it comes to the severe cases of West Nile virus, patients may need to be hospitalized. They may need IV fluids, pain medication, and overall monitoring for their condition. Whenever we get into meningitis symptoms, and again, that is the inflammation of the membranes that surround the brain and the spinal cord, the meninges. They are going to need pain management, antiemetics, which is medications like Zofran, Phenergan. These are used to help combat vomiting in these patients. And they're also going to need IV fluids for rehydration because they do have the symptoms of the vomiting and the diarrhea. So they need those IV fluids to remain hydrated and to rehydrate. Whenever we get into the treatment of the encephalitis patients, these patients are the ones that really scare healthcare providers. The encephalitis, and again, remember that is the inflammation of the brain itself. They need to be monitored closely. They need to make sure that they are not having an increase in ICP, which is intracranial pressure, and they need to make sure that they're not having seizure activities. So these encephalitis patients need to be also monitored closely to make sure that they are able to protect their own airway. These patients can oftentimes have paralysis due to West Nile virus. That mixed with the increased intracranial pressure, they may not be able to protect their own airway. They may be having seizures, and the doctors or other healthcare providers may have to intubate them to protect their airway. And you'll see a cartoon picture on the right that shows a patient being intubated. So whenever they do this, they're actually sticking an endotracheal tube down into the patient's airway so that they can hook them up to a ventilator so that the ventilator can help them breathe. These conditions actually happen fairly rapidly, so the healthcare providers really need to be on their toes to make sure that their patients are getting the respiratory support that they need. Majority of patients completely recover from the West Nile virus. Fatigue and weakness can persist for weeks or even months. Patients who have had the encephalitis and paralysis section, though, they will often have lingering neurological defects. And approximately 10% of those patients' cases are fatal. At this point in time, there is actually no FDA-approved immunizations for the West Nile virus for humans. However, there have been multiple vaccines available for use in horses. But of course, this is due to federal regulations being less stringent than for animals than they are intended for humans. And here is a list of my sources. I appreciate you guys watching and can't wait to watch yours.